Hello, welcome to the Healthy Human Summit. I'm your host, Dr. Allison Edmonds, and I'm so excited to have my friend Dr. Mindy Pelz here. She is really just an amazing human. I am fortunate to call her a friend. She is one of the Health Centers of the Future Platinum Doctors, and she today is going to blow your mind with some amazing techniques about fasting and how you can incorporate them into your cycle to optimize your hormones, and overall, of course, to discover what really are the underlying problems and just bring about your full health potential. Dr. Mindy is a public figure in the alternative health world and commonly known as the Reset Doc. Really cool things around that. She's created one of the most popular YouTube health channels out there, as well as created a private Facebook group consisting of over 30,000 members who participate in a monthly fast training week. So that is just amazing, like 30,000 people fasting at the same time. You right now, just go ahead and bookmark a page to check out her YouTube videos. And today I'll be just asking her questions and bringing that picture together for you. I again thank you for being here. I'm so
Oh, my pleasure.
You are
Yeah.
an author, a speaker, and an inspiration. So let's dive right in to just let's talk a little bit about hormones. How do you know that your hormones are balanced or imbalanced? And what a normal
Great
cycle
question.
or a healthy cycle would look like.
Yeah. No, well, for starters, thank you for having me. I'm really excited to talk about this topic, especially when you take hormones and you connect them to fasting, because there's a lot of misinformation out there that women shouldn't fast. And I have done a tremendous amount of research and looking at the science behind fasting, and I actually think fasting can be a tool for fixing hormones. So this is awesome, and I'm super excited to talk about it. Yeah, how do you know if your hormones are off? So here's where I'd like to start the hormone conversation and I wish somebody had told me this at 13, but I learned it at like 47, which is crazy. But we have a hormonal hierarchy, and it looks like this. If you want to have an effect on your sex hormones, estrogen, progesterone, testosterone, you're going to need to regulate insulin. If you want to have an effect on insulin, you're going to need to get cortisol under control. And if you want to affect cortisol, your go-to hormone is oxytocin. So what I love about that hierarchy is it's like, well, oxytocin sits at the top, which is awesome because oxytocin is so fun to try and get. And it can have a cascading effect of, okay, it'll bring cortisol down and it'll bring insulin down. And then when insulin is managing, then you go into your sex hormones. But I don't think that as women, we think about that enough. Like, we don't think about the hierarchy. We don't think about our hormones. I think insulin's become quite a buzzword because of everybody trying to lose weight. We've got a lot of diabetics. But what I really want to bring back to the conversation is that all of these hormones hang out together. They're like a big team. So as you know, right? I mean, how all the Dutch tests we've analyzed and looked at is like, how do you get these hormones working in synergy again?
That's really amazing. And I know you, well, it's so important and part of your mission to teach people so that they can teach their families and change, of course, the
Yes.
whole family's health. And the first thing that we always think about again with the buzzword insulin is diabetes. And we know that our children of this next generation, I'm trying to remember the actual stat, but I think it's something that 2/3 of the children that are born after 2000 will have diabetes. Is that?
Yeah. Yeah. No, you know what? Here's the stat to look at.
Yes.
And now, this might go to a worldwide audience, but 12% of Americans are metabolically fit. So what does that mean? That means that only 12% of Americans are insulin sensitive. Only 12% of Americans have insulin under control. That's horrific.
Yeah.
That has to change. And this is what I love about fasting is you can afford it, you have time to do it, you just have to know what you're doing. So when I look at that number, I'm like, okay, How do we get Americans, and then really it's worldwide now because our food is bled over into other countries, but how do we get Americans metabolically fit? And in order to be metabolically fit, you're going to have to manage insulin. And that's, to me, where fasting really comes in.
Yeah. And so that's really amazing because that conversation also brings in people. Sometimes we instantly disqualify ourselves like, oh, I'm diabetic. We can't mess with that. Or, but just to understand that is actually like the strategies are in place for the person that it is not metabolically fit. And then also, again, our children, like the opportunity to teach our children principles and strategies because they're up against some rough odds, right? I know we've talked
Yeah.
about this so many times, but if our children are gonna have, like, just statistically speaking, they're all gonna have problems with insulin, then they're all gonna have problems with their sex hormones.
Yep. Well said. That, I think that is the next level we need to understand. And it like brings tears to my eyes because the kids growing up in today's world, what's happening is good-hearted parents are going into the grocery store and buying the food on the shelves that they have assumed the FDA has considered safe, and that they're bringing it home and feeding their children, and they're creating insulin resistance in their young children. And then as they grow up, they get these, everything from obesity to diabetes, type 1 diabetes, not just type 2. We've got anxiety, we've got learning disabilities, and they now have a symptom, they enter into a medical system that gives those symptoms labels, that medicates those symptoms, and they don't realize that it all started from their food. Their food. And these are not parents that are oblivious. These are parents that have said, okay, government, okay, grocery store, when I walk in there and I buy food, I assume you've already vetted that food. You've already decided that food is safe for me. And what is the most mind-blowing thing is it's not. There's over 50,000 ingredients that have been added into food in the last decade that are labeled GRAS, generally recognized as safe. That means that they are safe until proven guilty. Do you know how much money it takes to prove an ingredient guilty? So the FDA will allow any ingredient to come in unless there's something proving that it's not.
And
That's
we
crazy.
find that for years, like
For years.
like 5, 10, 30 years later. And so, well, really, we should have just started with that section for sure. But I mean, this is where so much of, I know, your passion, my passion, and so many of the other doctors that are going to be part of this summit, it's for this next generation. Um,
Absolutely.
and of course for our own health and healing. So hormones, it is a really hard topic. We know that 50% of when a baby is conceived will end in a miscarriage or a spontaneous abortion.
Really? 50%?
Yes.
50%. That's crazy.
It was like 1 in 4, and then I, like, last 4 sources that I looked at were now 1 in 2. And they're looking at 1 in 8 couples can't even conceive. So it's just like when we're talking about our sex hormones and we're talking about this next generation, it's such a big topic. And the amazing thing is, and why I'm so excited Dr. Mindy's here and bringing her expertise is because fasting is such an integral component. Like, we can do, every kind of supplement and detox and all these great things, but sometimes it's the magic pill for better.
Yeah, yeah, absolutely.
Like, it's the thing that shifts
Yeah.
the way that the body is going to function. So I know we're going to break down a lot of great things today, especially fasting with your cycle, which I'm so excited. So let's go back into, like, what is a healthy, we're trying to get rid of the normal. What does a healthy cycle look like for a woman?
Yeah, so a great question. And I want to just back up because it's daunting when you hear the statistics, like we're rambling off, and there's a moment that I think, especially if you're a mother, like, we're already overwhelmed, right? There's already am I good enough? Oh, you mean I need to do more kind of thing? And then if you're trying to become a mom, that's usually when this kind of information can be empowering. But I think what we have to realize is, let's go back to where we started the conversation, which is insulin influences sex hormones. So if you've miscarried, if you're struggling to get pregnant, let's just start with insulin. Let's stop looking at the sex hormones and start with insulin. Now, having said that, if you look at a woman's cycle, and I'm just going to say 30 days, they say that an average cycle is anywhere from 25 to 35. So let's just say 30 days. The first part, day 1 to day 10, there are 2 hormones you want to think about. And the number one is insulin. Again, that is where, if you are insulin resistant, you will not make a hormone called estrogen. Now, if a woman listening to this has had trouble getting pregnant, this is where you got to really listen in closely, because that first part of our cycle is where insulin resistance really shows up, because then you can't make estrogen and then you can't ovulate. So that's day 1 through 10. As you can move closer to day 10, you start to get a big surge of not only estrogen, but testosterone and progesterone. And from about day 10 to day 15 is your ovulation period. All women are different. So, but that's usually the section. And that is the time when you have like all these 3 hormones working at their max. And I laugh, because here I am, a 51-year-old woman. Like, I get a period like every 90 days. Sometimes it comes, sometimes it doesn't. And I'm like thinking, shoot, I wish I had known this when I was like 30, because I could have used it to my advantage. And that is that in that time period when you're ovulating, you are a flippin' rock star. Like, your superpowers are at its max. And what I mean by that is estrogen makes your skin glow, so you look beautiful. Estrogen gives you clear thinking, an appropriate amount of estrogen. It makes you a great conversationalist. And I mean, the list goes on and on. It makes your hair very full. Progesterone calms you, so it makes you kind of chill. And then testosterone gives you libido and it gives you motivation. So in this strange little 5-day window, you are a great communicator, you look beautiful, your motivation is high, and your sex drive is high. So in that time period, you want to use those hormones. And one way, and we can chat about this a little more in detail, one way you can really make sure you're using those hormones well is by making sure that your liver and your gut are very healthy. So during that time, what about eating a lot of probiotic, prebiotic, polyphenol foods, so you can break that estrogen down so it gets into the cells? Then after day 15, there's another small little window for about 4 days where you need to become insulin sensitive again. All your hormones are dipping down, but you're about to build up to the big crescendo, which is progesterone. And progesterone kicks in about day 19, 20. And progesterone, if progesterone could talk to you, progesterone would say, chill out. Like, just chill out. You don't, like the type A woman, the extreme faster, the marathon runner, when we push ourselves as women through that moment at about day 19, you tank progesterone. And if you tank progesterone, again, you will not hold a baby. A fertilized egg cannot implant on the side wall of the uterus. And you may skip a period. You will feel anxious. You'll have trouble sleeping. You were designed. I mean, I, as a woman, I feel like I can accomplish anything except on day 19. Day 19 to day till you bleed, you're meant to sit on the couch and watch Netflix. So it's each part of the cycle. We have never been taught that our lifestyle needs to change as our cycle is changing.
So that's really exciting. I was talking to a patient just a couple of days ago, and she said, I wish I would have tracked my cycle early on, because how often do you just wake up and you feel these things that you're talking about? Like, you're feeling, oh my gosh, I just want to lay around, or like, or you snap at your partner, or like whatever the case. And then you have these thoughts of like, what's wrong with me? Like, I'm not doing something. I just need to get up and push through. But
Right.
really, when you can respect the cycle that was built into you, Now, granted, there are some imbalances
Yeah,
that most of us are experiencing, but tracking your cycle is probably the first thing people
absolutely.
do. It's like
Yep.
get familiar with your body, get an app. There's a million free ones, right? Um, and then I don't know about well, like just different time in my life. Like I like using the ovulation strips to track my ovulation and just like really know. But I just wanted to jump in there with that because like it's a lost art. No one ever told us to track our cycles.
Yep.
If it comes, it comes.
Right?
Yeah.
Well, so you and I have talked about this before, but this was like why at 47, here I am like going through perimenopause. And all of a sudden, I started fasting a bunch and lost my period. And I was like, oh, I guess I'm going into menopause. But then I had a lot of symptoms of like menopausal symptoms, but really extreme. So I ran a Dutch test and find out that like my hormones are worse than a postmenopausal woman. So I started to unpack the cycle here at 47, and I thought, why do we not know this? I mean, I don't know about you, but when I had a health ed class, I remember the room we sat in, I remember the teacher, I remember her going over like managing blood flow, and I remember like you could do a pad, you could do a tampon, and by the way, you can get pregnant now. Like that's all I learned. How about you?
Yeah. I mean, and I don't even remember that much for sure. Like it just was like, what, like nothing. Nothing.
Yeah,
But our moms didn't even
right.
know to teach us those things. So that's going to be, so everyone, this is a free pitch right now. If you want Dr. Mindy to teach your health ed class, no, I'm just kidding. But you can,
Hey, if we could get thousands of people on a webinar, I would. And I first have to teach it to women, and then we could go down and teach it to the teens.
and then
So,
incorporating like the working out schedule. I love that you and some other physicians I've started to hear about that because again, I remember being an athlete and
yeah,
like competing at a state level and then going into college and things and you have like days where it's the worst workout ever. Your performance sucks. You're just like, what is wrong? And then knowing now what I know, I'm like, oh, I wish someone would have literally structured my workouts not around necessarily the competitions, but around my cycle.
right.
It would have been a huge game changer. So,
Yep. Yeah, agreed. And I was on this is why summits like this is so important. And what do we do as women really well is we chat with each other. So as you guys are listening to this, go have these conversations with at the ladies' nights outs and your friends. But I was on a interview. Dr. Zach Bush did a panel on the topic was different cycles. So how to use our lifestyle around different cycles. So he asked me to come on and talk about food and fasting for specifically menopausal women. And on the panel, believe it or not, was Tom Brady's trainer. And he got up there like pretty macho dude. And he was like, oh yeah, we know that you don't push a woman hard the week before her cycle. And I'm like, okay, how does Tom Brady's male trainer know that? And most women don't know that.
yeah,
It's crazy.
I know it really is. But in the mission of spreading this word, it's like, how about every college athlete coach of any, it doesn't matter what sport, if they knew how to coach their women, oh man, the jumps and the gains would be
Oh,
amazing. But then also, of course, you're preserving their health.
the
So
injuries would go down, and that's what this trainer said. He goes, oh, we know that we have to adapt and change the cycle for, and he's dealing with collegiate and professional female athletes. Like this guy is dealing with high performing. He said we see the injuries go down and we see the performance improve. And he's like talking to the panel like, don't you guys know this? It was so fascinating.
so if you wouldn't mind just touching like just briefly so people can jot down just a little bit of a note, like when you start your period, that is of course day one, what type of a workout or intensity level, and then like ovulation and then the week before your period. Can you just briefly
You
touch?
want to do workouts first, or you want me to kind of do everything?
Well, it however you want to do it. If you just
Okay, well, so let's kind of chunk it down. What we've done is I've come up with 3 different phases of a woman's cycle. So like I told you, this is like brand new. I just finished a book. It's at the editors and it probably won't come out until 2022, but we're going to try to get this concept out on our social media as quickly as possible. But there are 3 phases. There's what I call a power phase, a manifestation phase, and a nurture phase. So this is how it works. Day 1 is the day you bleed. So from day 1 to day 10 is your power phase. We named it power phase because if you want to go run a marathon during that time, you're fine. Now, a lot of women are going to say, well, I don't feel like running a marathon on day 1 of my cycle. And what I'm going to say to her is that's because you didn't do the back half of your cycle right. If you do the nurture phase right, once you start to bleed, you feel amazing and you feel powerful. So from day 1 to day 10, you can go into a 3-day water fast. You can do any fasting that you want. You can go into extreme keto. If you want to go into low keto, you can do that. If you want to run a marathon, if you want to push yourself during that time, that 10-day period is huge. So do that. Like you actually, your body will thrive with a hormetic stress during that time. Then the manifestation phase is day 11 to 15. And I call it the manifestation phase because you can, with all those hormones, you can manifest whatever you want. So at that time, you've got to be with testosterone at its highest. If you want to go weight training, man, go do it in that 10-day period. I have a vision where we stop looking at women stop looking at their workouts in a weekly variation, but we look at it in a monthly variation. So 1 through 10 would be a lot of cardio. 11 through 15 would be all weight training. And then we encourage anything that supports the microbiome. And then intermittent fasting, 15 hours, fine, but this is not the time to go into a big fast that's longer than 15 hours. Now, when you come out of the manifestation phase, there's this little weird moment where you have another power phase. We call it the second power phase. It's about day 16 to day 19, so 4 days. You can go back into your extreme cardio. You could run your marathon then. You could, socialize, party all night then. Like you could fast as much as you want. But then it's day 20 that's critical. When you hit day 20, you grab the yoga mat or sit on the couch or go for a walk. So your progesterone is very sensitive to hormetic stress. It does not like hormetic stress, and a hormetic stress is a positive stress. Progesterone doesn't like any stress. And part of that is because your body will always choose to make cortisol over any other hormone. So if you are asking your body to even make a little bit of cortisol on day 19, it doesn't have anything left to make progesterone. So from day 19 till you bleed, that's your yoga, that's your walk in nature. That's when you don't fast. That's when you do your feasting and your hormone building. So that's sort of and then when you bleed, you start over again. Now, the minute your period starts, you're like, good, let's go. And you got 10. So you can see how you can move through the cycle, honoring the different ebbs and flows.
And I love what you said that, like, if you do the tell me that again.
The nurture phase?
The nurture. I'm trying to say nutritive.
Yeah.
When you do the nurture phase properly, then as you go into your cycle, then it's going to be different. But that makes perfect sense because as our hormones are dancing, if we need to support the progesterone. So, and I'm just going to repeat this also for myself. But you're saying that if we're stressed, even good stress, but if we're just piling too much on and not taking that time for ourselves after that day 19, then that's when our progesterone gets converted to cortisol.
That's right.
And then it's utilized for stress.
Right. So let's chat to the person who's having trouble getting pregnant, or the person that's miscarrying. So if you may know you have low progesterone, or you may not. But if that's your fate right now, then I would encourage you to really honor that day 20, day 19, 20. I mean, I can't, everybody's a little different, but you got to honor that moment and do something different. That's why we call it nurture. You got to nurture yourself, not other people. We're so good at nurturing everybody else. We got to nurture ourselves in that time.
Yeah. Yeah. Real quick, if it's all right, I'd like to just touch on a couple of the ways that they can test for hormones, because I know, like me, I'm instantly like, when I'm learning something new, I want to know like where I fall on here.
Yeah.
But they might have just gotten their blood work and hey, your blood work looks great. So can you just tap on just testing, our favorite testing, things like that, so people can kind of figure that out?
Yeah. When I first started to understand hormones, I had heard about the 24-hour urine test, and there were a couple companies that did it. And I literally like looked at it. I'm like, that's kind of cool, but you have to stay home for 24 hours and like pee on, in a jug for like 24 hours. I'm like, yeah, that's not going to work for me. Then of course, there's the blood test that you can do at your doctor's office, but they don't time that according to the day of the cycle. So that doesn't really make sense to me why you would do that. And then I discovered the Dutch test, and holy cow, am I a fan of that test. And the reason is you can not only see where your sex hormones are, but you can see where what your cortisol levels are doing and what insulin's doing. And you can see what estrogen's breaking down into. You can see if stress is tanking your progesterone. You can see if you have enough melatonin. Like, the list goes on and on and on of the nuances of what you can see. And once I understood that, then I was like, oh my gosh, we could prevent every woman from having any kind of infertility problem or any kind of breast cancer, ovarian cancer problem with this test. Like, every woman every year should get this test so that she knows where her hormones are at. And then based off of that, we could help her build a lifestyle. And I think this is really an important topic. What has happened in women's health, and you see it in menopause all the time, is that once you have a hormonal symptom, there's a pill to solve that symptom. And there's either like a synthetic pill from your medical doctor, or there's what I call the magic mushroom from your alternative doctor. And I don't believe that you can solve any hormonal problem with a pill. You got to start with lifestyle. Clean up your lifestyle, think about this circle that we just talked about, and then do that for 90, 120 days, and then you can go to your pills and figure it out. But we're not that simple.
Yeah. Isn't that's always nice to know too. It's not that simple. Like, um, so
Right.
and that was, I mean, that's really beautiful. So the cool thing is, like you said, we're all complex. And whether you know that your hormones are balanced or whether you don't know if they're balanced, or maybe you are, well, do you want to tap on, sorry, I always like keep thinking of other things, like let's just
Yeah, no,
lay
all
this
good.
foundation. So maybe you can tap on just a second, like people that feel that they're hypoglycemic or that they have to eat all the time, because we talked at the beginning, we talked about insulin being, of course, like above the sex hormones. We talked about balancing those. So let's go back to that for just a second.
Okay, perfect. So the thing to remember is that there's two ways we get energy. One is from sugar, and when I say sugar, I don't mean like a Snickers bar. I mean like blood sugar, like the food you eat. And the other is from fat, which means your body's burning fat for energy. So we call them sugar burner, fat burner. Here's the deal. You're meant to switch in and out of these two states. But what if you've never fasted before, if you've never tried the keto diet, if you've just been eating because 6 meals a day because you thought that was what sped up your metabolism, or if, like many of us, you thought breakfast was the most important meal of the day, then you've never given your body a chance to be a fat burner. Even if you love how thin you are, this is not about a fat thin. This is about these energy sources. So the first step to managing insulin is to be able to get your body to move to a fat burner. And how you do that is by intermittent fasting. And for some women, to me, intermittent fasting is 13 to 15 hours. And for some women, that's huge. I mean, I know for me, when I first heard it, I was like, oh, I can maybe do that one day. That'll be good. I'll do that one day. Little did I know this would become like the way I approach everything now. But it's meant to be done every day. And if 13 to 15 feels too big, I always say push your breakfast back an hour. Do that for a couple of weeks. When that gets easier, push it back 2 hours. And now what you're doing is you're moving yourself over to the fat burner. Now, if that feels hard and you're struggling there, then you're going to need to come over and look at your foods, and you're going to need to start to bring down your sugar level. So I always say start by taking out your refined flours, your refined sugars, and change your oils. Get rid of the canola oils, the vegetable oils, the all the toxic oils, cottonseed, corn oils. I have yet to meet a person, and we have done this with hundreds of thousands of people, that haven't been able to intermittent fast by following those two steps, slowly increasing their fasting window and taking those toxic foods out. If you do that, all of a sudden, boop, you become a fat burner. And when you're a fat burner, you make ketones, and ketones go up to the brain and they tell the brain, you don't need to be hungry. They stop the hunger hormone. And the next thing you know, you're going 16, 17 hours fasting because the hunger hormone keeps kicking in.
So I love this, and just as I was learning to fast and learning these strategies, it was really cool. Like, I was the person that I had to eat every 2 hours, and that's what they taught us in our exercise physiology courses, right? 6 meals a day. And I would get shaky and a headache if I didn't eat. Well, little did I know I wasn't getting enough fats. And so we started incorporating these strategies, and I got to a good place where I could do fast here and there. And then I started hitting some more hiccups. And all of a sudden, I'm like, I did a 5-day fast 2 months ago, like water fast, 5 days. It was
Right?
a breeze. And then the next time I tried to do a 5-day water fast, I literally wanted to kill my husband. Don't tell him. And I was only 2 days in. I mean, it was a disaster. I was not myself. And then I figured out, guess what? This wasn't a good time in my
I
cycle.
was going to ask you. Yep.
Yeah. So
Yep.
that is where, my friends, like, if you've ever tried to fast, if you feel like you're on that blood sugar roller coaster where you're crashing or whatever the case, like, this is the exciting part about fasting with your cycle. Dr. Mindy, blow our minds, ready, go.
Well, so here's the easiest thing to do. And I love to step things out so that people don't get overwhelmed. So if you're new to fasting, the first thing is do what I just said. Just work on pushing your breakfast back and take all those refined carbs out and sugars out and change your oils out, because that'll make this path a lot easier. Now, once you've got yourself like in a groove with that, now let's see how we can get you to fast a little longer. So again, day 1 to day 10 in that power phase, you want to be insulin sensitive. So you could push yourself to like 17 hours of fasting, which is what we call autophagy, where the cells start to clean themselves up. If you feel like you want to keep going, you can go 24 hours. If you want to do a 3-day water fast, go for it. Do it in that period. And then as you go into the manifestation phase, when you're like in that day 11 through day 15, now let's back off the fasting. You can do 15 hours, no problem. Let's lean into, like, I've even analyzed like people who do well with the carnivore diet. You could lean into the carnivore diet there. You can do, a little bit of fasting, but your focus should be your gut, because your gut health is going to use those hormones. Then when you come out of that on day 16, you want to fast a little more, go for it. You can go into a deeper fast. And then day 19, you start to wind the fasting down for about a week. And what's interesting is that you'll see, just like you said, I have it so dialed in now. I literally at 47 thought I was going into menopause. And then when I applied this to my cycle came back regular like nobody's business. And how I know I need progesterone is that from day, all the way up till about day 19, I can fast pretty easily. But around day 19, all of a sudden at 9 in the morning, I want breakfast. And I'll be like walking around the office going, why do I want breakfast? What is going on with me? And then I'll pull my Clue app up and I'll be like, oh yeah, progesterone. Okay, I get it. And I make a conscious shift at that point to really focus in on not fasting and hormone building foods like potatoes and sweet potatoes and beans and citrus fruits and tropical fruits. These are all quinoa, rices, like these all will really help you build progesterone.
That is awesome. So, and I think, so many people don't have a regular cycle. And it doesn't matter how old they are. I mean, taking care of a 19-year-old, she's having like 46-day cycles, like just can't quite figure it out. So, can you give us a couple strategies for that person?
Yeah, I would love for you to put her through the cycle because we've been doing this with perimenopausal women and getting their cycles back on track, which is so funny. The other ironic piece, if you are over 40 and listening to this, is that it's not normal to go into menopause under 50. That there is an environmental reason you've gone in, and you want to fix that environmental reason. So what I just explained to you, we were able to get women in perimenopause to get their cycle back on. So now let's go to the 19-year-old. If she has 40-day cycle periods, I think the fasting circle is what I call this. The fasting circle, she just has to go through that. And we actually came up, I can send it to you because I'd love for you to try it. In my new book, there's something called the cycle reset, where you can just take every 30 days. You start the cycle reset on day 1 of your cycle, and I already pick out the fasts and foods you should eat, and you could just go all the way through it. What I think will happen is a lot of women will regulate their cycle. A lot of women will stop infertility. A lot of women will stop the situations because this is an opportunity. You can use the cycle reset to really get that pattern back again.
Yeah, that's
And
that's
she, I think also for her, like the first step is really watch that back half. Is she getting progesterone
and
and the
that
stress around that?
and
I'm
and
sure you've probably already done that.
well, I mean, you're just, it's turning new wheels in my head right now. So I'm also thinking about this person because I mean, it represents so many of 19-year-olds right now that even
Right.
during that nutritive
Uh, nurture,
nourishing,
like nurture, like, oh, we're
yes,
gonna nurture a little
nurture
baby.
during that like you're also feeling like meh, and so they're craving the sugary, the salty,
Crave carbs.
the
Yep.
packaged stuff and the additives and preservatives and things like that. And so we know that those can be damaging too. So that
Yep.
they get into a bit of a vicious cycle. So when we say a nourishing phase, like Dr. Mindy keeps talking about, like you're good, you're about to say something, but go ahead, go ahead.
Yeah, no, no. So then this is where I swear this circle is going to be foolproof for so many women because, so let's say I lean into the processed carbohydrates, like you just mentioned, in that nurture phase. Well, that sets me up for insulin resistance in the first power phase. And if I'm insulin resistant in the power phase, I won't make enough estrogen for the manifestation phase. If I don't make enough estrogen, then I don't ovulate within that window. I probably ovulate a little bit later. And now all of a sudden I'm off with my nurture phase again. And you can just see how it becomes a vicious cycle. So in with
Nope.
that person, what if we got our nature's carbs? What if we, because it's the carb loading during that time's not bad, it's the processed carbs
Yeah.
that are bad.
So how powerful is it then to shift a person's mindset? Like, hey, if you knew that you had these 5 days and your only job during those 5 days was to get sweet potatoes and squash and beans and like all that great stuff, and you had this like mission, I just feel like that would change. It would completely shift our mindset instead of like this, like the take everything away. I can't have this. I can't have that. It's like you focus on what you should be having. You'll just be a better human. Let's be honest.
Right. Right. Well, exactly. And then, you know what? This is where you could say, like in the fasting world, women are like, oh man, I got to fast differently than men. And I'm like, no, no, no. This is freedom. Because what happens when you hit the nurture phase is you get to feast and your body wants you to feast. So you're working within your design. So, and this can, if people are listening to this and they're not interested in fasting, the same thing applies to your food. That week before, if you don't eat the processed foods, you can carb load and your body will use those carbs totally differently than on day 7 of your cycle.
And I live.
So,
Oh, sorry. I mean, I
no,
lived that. I remember, like, figured out, like, by myself, like, this was a long time ago. Oh my goodness, it's so weird that I crave this greasy, salty pizza the week before
right.
my period. But if I had it, my cramps were wicked the next week. Like, it was crazy how bad they were. And I just started to flip that. Okay, I know I'm craving a carb, but if I don't have wheat and I don't have these bad oils, the period, it's totally different.
Yeah.
So side note on that is you're not supposed to be cramping and
Yeah.
clotting and miserable and such PMS that you want to get a divorce every month. Like that's not normal. It's not healthy. So I'm sorry, I
Yeah.
didn't mean to cut you off though. Go ahead.
Yeah, no, and I think that's what I'm hope comes out of this conversation is that we don't beat ourselves up because our workouts suck and we're craving, a big something like a bowl of pasta. It's understanding why that's happening is really key to the whole cycle. And I think that's what is the freedom is for us to realize that we're not meant to do the same lifestyle day after day after day after day.
So, speaking of that and listening to your body and things changing, let's talk for a second about intermittent fasting with pregnancy and nursing.
Yes.
Uh,
Let's.
we've had such exciting conversations surrounding this, and um,
Yeah.
it's kind
I'll
of like, where
I
do we start? Like, well, first off, I just want to say it's always been a hard conversation, and you're welcome, people, for just having this conversation because everyone just wants to back up and they want to say, "Oh, it's not research." Like we're afraid to make recommendations. We're not making recommendations, but we do have some amazing experience to share.
Yep.
And what we know is that if insulin must be balanced for your sex hormones to work properly, and we know that when we enter pregnancy, all your sex hormones, whether they're balanced or not going into it, determine how they work, right? Uh,
Right.
And then, of course, that it affects our insulin levels, which we know because our gums change. So many people have gestational diabetes, and I'm just rattling on. So if you want to launch it,
Yeah, no, I think so here's my vision for women that we would use what we just talked about, the principles of this fasting circle to really acknowledge when to eat, when not to eat, what to eat, when to fast, not fast before we get pregnant. So now we've cleaned up our insulin sensitivity, we've cleaned up our microbiome, and we've cleaned up our cortisol mismanagement so we're able to make progesterone. If we do that going in and then we get pregnant, now we're in a place where pregnancy is going to be a little easier. Now, once you're in pregnancy, you've got to listen to yourself. So, I mean, any pregnant woman will tell you that, especially in the first trimester, you got to eat like you're growing a human. So you got to keep eating. So I always found, at least in my pregnancies, that staying ahead of the nausea was really important. But you want to have a food value system. So when we say eat or we say feast, that doesn't mean go to McDonald's. That doesn't mean go get pizza and a tub of ice cream and sit on the couch. That's messing your hormones back up again. But if you want a big potato, if you want, something like that's really carby, like some fruits, some organic grass-fed dairy, those kind of things, go for it. So, and you want to eat all day long. I am not a big fan of fasting on during pregnancy. I think it'll be interesting to see with Jessica how this like works out because just to watch her go through the different phases. But I will tell you, we've been watching her be an extreme faster. Then she gets pregnant, and then I told her, I'm like, don't fast. Your hormonal like waves will be so bad. And sure enough, she like tried that 1 or 2 days and was like puking in the trash can. And I was like, okay, get the pretzels out, get the salty things out. So I pregnancy is not the time to fast. Pregnancy is the time to lean into fat, good fats, and pregnancy is the time to lean into your microbiome. You pass your microbiome down to your children. So start working on the polyphenol, the prebiotic, the probiotic foods. Really work on your microbiome because that has more of an impact at that moment. Fasting is not your tool at that moment.
no, definitely not a tool. However, I like to bring up because I was one of these people. I was so sick that for days, the only thing I ate was broccoli and ranch. Like I couldn't keep it down, right?
Yeah.
So and you always wonder in your body's innate wisdom, like was that my body's way of balancing my gut
Right.
somehow?
Well, do you know that your microbiome, actually the bacteria in your gut choose your cravings? They determine your cravings. So I haven't done research on this, but I'd be curious what is changing craving wise when like or I'm sorry, bacteria wise that might be changing the cravings. but your cravings mean something. You've heard of pregnant women eating dirt, because they're craving minerals. Like, there's the weirdest things we crave, and there's something to that. And so honoring that, and knowing that those are nutrients that your body needs.
Yeah. Well, it is fun. And everyone, like people that have had multiple children, they talk about how each pregnancy is different. I mean, it's not just the kid or their DNA, it's your gut, it's your
Yes.
hormones and how you've set that up. So I'm excited and thinking about growing another human. Like, what's this next pregnancy
Right.
look like?
Mine with my daughter, who is the oldest, I could not get enough of lemonade and sandwiches, which now you would never catch me eating or drinking that, but like every day it was like lemonade and sandwiches. With my son, it was ribs and artichokes, like lathered, dripping in butter. And I always think, I don't know what that meant, but over and over and over again, those were my two go-to meals.
That's funny. It is. It's fun. I couldn't eat chicken with pregnant with Titus, not at all. And the kid won't touch it. And he's about to turn
Oh,
3.
see, that's what I wonder. Like, if you pass your microbiome off, if it's a microbiome change, what does, and I have asked my kids if they crave those things. They don't crave them. They like those meals,
Yeah.
but
I don't know.
I
It's
have,
fun.
yeah.
So then, of course, when you're producing milk for a tiny human, what are your thoughts on the intermittent fasting and yeah, I mean, it
Yeah.
definitely is a whole conversation we could have surrounding that because the listening to your body, the getting the good stuff. But then also people sometimes at this point are wanting to rebalance their hormones because like I did not set my hormones up properly before getting pregnant and it was just a like fiasco, right?
Right.
And then after having the baby, there was a lot of anxiety and the postpartum stuff, everything's crashing. So it's like I needed a tool, but yet I'm producing
Right.
sustenance for
Well, so again, let's give like a big overview so people can see. If you're thinking about getting pregnant, you really want to clean up your insulin sensitivity and you want to honor that week before. Like, that's the most simple thing. Like, you want to get your progesterone levels back up by honoring it the week before your cycle, and you want to clean up insulin sensitivity, and then you want to take good care of your gut. That's like pre-pregnancy. Once you're pregnant, no more fasting. You really want to think about your microbiome and good fats. So, lots of foods that support a healthy microbiome, lots of good fats. That's all you're doing for 9 months. Then, after the baby's born, okay, what does the baby need at that moment? So, we're back at microbiome and good fats. You can continue that. But with fasting, we have to remember that there is a little bit of a detox reaction, and that kicks in about 17 hours of a fast. At 17 hours, you go into something called autophagy. And autophagy, when you stimulate autophagy, sometimes it's like turning on the intelligence in a cell. And sometimes the intelligence looks around and is like, hey, this cell's really bad. So we're going to go ahead and kill this cell. And when it kills that cell, any toxin that was inside that cell will get redistributed into the body. And many times that redistribution will go into breast milk. So I wouldn't fast more than 15 hours if I was nursing.
that's
And then when you eat, you got to eat. Like, there's another misnomer in the fasting world: calorie restriction versus fasting window. So a lot of the studies are calorie restriction. So when you're talking to your medical doctor and you're like, I think I'm going to try intermittent fasting, and they're like, no, 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 you're nursing. What they are thinking usually is that you're going into a calorie deprivation state, which is not good for nursing. But when you are intermittent fasting effectively, and then you open up your eating window, eat, 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 eat. You need more calories, you need more nutrients to be able to feed your baby.
that's awesome. Those are great parameters. And it clears up a lot because like you said, you're gonna have to maybe have a conversation with another practitioner or whatever the case. And it's just like, no, I'm eating the same amount of calories, if not
Right.
more. I'm just putting it in this nice little window.
Exactly. Exactly. I've noticed that when doctors don't understand what you're doing, they say no. Just no, 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 especially when you're dealing with a pregnant woman or a nursing woman. And that's why I like to get into the nuances and help people understand it. Because like I heard, there's a a woman out there that's teaching a lot of great things around eating for your cycle. And she's like, no fasting for women, or, she's a little bit of intermittent fasting. But when I dove into her research, what I saw is that she was quoting research on calorie restriction. We are not advocating calorie restriction. We look at feast famine cycling. So you're just creating fasting windows, and then you're creating feasting windows. And the nursing woman needs to feast.
Which is a great time for sure.
Which is awesome, because you probably can feast and stay in really good shape too.
Yeah, yeah. So much amazing information today. So I don't know, is there any just final words? I mean, those were great, really wrap up things just to kind of, I don't know, I always think of filing them in my brain.
Right, right. Here's what I would say is I hope this is like new information for people, that they are like, either they heard a little bit of it, or maybe they're like, whoa, I'd never really thought about this. So whenever we get new information, and this is really paradigm shifting information, whenever we get new information, new paradigm, there's a moment you will reject it, and you will be like, no, I don't understand it. I'm just going to go back to my old ways. So this is why I encourage people, stay with the information. We have come from a society, a healthcare system that has you looking at your health with one symptom, one diagnosis, one pill, one problem. But what we're talking about here is a very dynamic lifestyle that will never have you worrying about a medical condition again. But it's dynamic. So just be curious about it. So if you are listening to this and you're like, oh my God, that's so overwhelming, I'm going to ask you to change overwhelming to curious. I'm so curious about this. And then from there, you can go to like my Instagram, you can go to my YouTube. By the time this comes out, we'll have the fasting circle out there. You can, if you're over 40, you can go to my book, The Menopause Reset. I map out everything in a very simplistic way. So I give you steps. So stay with the information and know it is paradigm shifting. It's different. But this, I strongly feel, is the next elevation for women's health. This is the next moment where we can stop all of the diseases. We can stop the PCOS. We can stop the infertility. We can stop the miscarrying, the breast cancers, if we come back to understanding this cycle.
That is beautiful. So the new book is called The Fasting Circle, right? So everybody can.
Now the new book, we'll see what it gets officially. Right now, its working title is The Fasting Fix for Women.
Okay.
So, but we'll see. That's the working title.
Well, that is awesome. I encourage everybody. Absolutely. Dr. Mindy has one of the best YouTube channels ever. It is, I mean, so much great information. I love your energy and just your teaching style. So I appreciate your time. And I know, yeah, look for her new book that will be out. And then also check out, there'll be some downloadable gifts from Dr. Mindy, which will be really exciting.
Awesome.
So thank you again for your time. I mean, the information.
Oh, my pleasure.
So valuable. And I mean, really our big mission, of course, is to help people grow healthy humans. And yeah, thanks. And we'll.
Yeah, and I would, I thank you for what you're doing, because it's so interesting when we go into like our 40s and 50s, we start putting the puzzle pieces together, and then we look back and we go, oh man, I wish my 20-year-old self and my 30-year-old self had done that. So, in menopause, what happens is there's a hush hush. Nobody really talks about it. And what I think we have to do as women is really talk about this stuff more and learn about it more and be, again, curious about it. So I love what you're doing as well. Thank you for throwing a summit is not an easy task. So thank you for doing that.
I love that you said throwing. I mean, I love to throw a party, but throwing this, it's definitely been a little, it is so amazing though, to connect with other practitioners and just share, I mean, your life's work, like you have compiled and that you have to give. So thank you so much.
My pleasure. Thank you.